Imagine walking into a veterinary clinic where every team member is confident, collaborative, and fully committed to delivering gold standard care. A place where nurses step into a role of leadership, implementing clinical decisions based on evidence. Risks are proactively managed, care performance is always reviewed, and the clinic always strives to provide consistent, effective, and patient safety. This is the power of clinical governance. In an era where veterinary medicine is advancing and becoming increasingly complex, clinical governance serves as the backbone of accountability and quality, ensuring that we do not just meet but exceed expectations of our clients, community, and society. It is more than a tool, it is a mindset, a culture, and a pledge to excellence. Now, you may be wondering, what is this? What does it entail? Is it hard to implement? Well, my name is Kaylee Zan Govender, and today I'm here to explore what clinical governance really means, why it is critical for us veterinary professionals, and how we can overcome challenges to implement it. Turn to a new blank page in your mind and grab a pen because you're going to want to elevate your profession with this. What is clinical governance? Clinical governance is a structured framework designed to integrate systems and processes to simultaneously work together in enhancing patient safety and the consistent delivery of high quality care. Rather than focusing on individual tools such as evidence based practice or quality improvement in isolation, which is only one quadrant of care, clinical governance connects multiple elements as a part of an overarching process to achieve measurable and meaningful outcomes. At a practical level, it provides a systematic approach to integrating activities derived from the critical purposes of structure, accountability, and quality control. It serves to provide a structure by organizing tools into concise, systematic processes to ensure consistency and efficiency in the delivery of care. This may include implementing activities such as checklists, standard operating procedures, or regular auditing systems. It provides accountability as clinical governance promotes the courage to change, encouraging nurses to adopt growth mindsets and self reflect on knowledge gaps and address them. Lastly, it serves to provide quality control by emphasizing the importance of continuous cycles of monitoring, reflection, and improvement. This ensures that the clinic standards evolve based on measurable outcomes, patient needs, and updated scientific knowledge, creating a culture of excellence and continual professional development. At its heart, clinical governance revolves around critical concepts we nurses strive for, which are patient safety and quality care. It morphs these concepts into actionable, trackable processes, giving us the privilege to lead real improvements. For instance, implementing a surgical checklist is not enough on its own. Clinical governance ensures that the checklist is applied consistently with other tools, monitored for effectiveness, and adapted as required to achieve optimal outcomes. By embedding structure, accountability, and quality into workflows, clinical governance not only safeguards patient safety but enhances our professionalism as nurses, fosters collaboration, and promotes a culture of continuous improvement. Here's an image that shows you the four quadrants of clinical veterinary care. As you can see, they have multiple aspects that make them up and contribute to each quadrant. Here's another image that also shows the experience and quality of care, which is made up of your consumers, clinicians, and managers. And here is another image that shows how deeply interlinked all these processes are and how they work together towards improving quality of our care. The tools used in clinical governance that I will be speaking about later, we have our evidence based practice, which is a process used to review, analyze, and translate latest scientific evidence. Quality improvement, which is the systematic approach that is guided by data to improve the quality and safety of healthcare delivery. We've got systems thinking, the ability to look at complex systems and consider its interconnectedness and interdependencies, not just isolated components. We've obviously got our checklist and standard operating procedures, courage to change via growth mindsets, benchmarking, which is a process that compares the performance of a healthcare organization to others in order for improve quality, efficiency, and patient experience. And then we've got clinical auditing, which is a process that evaluates healthcare against established standards to improve patient care and outcomes. We've got guidelines, legislation, and conduct. And then we have beneficence, which is the ethical principle that requires all professionals to act in the best interest of their patients. So, why is clinical governance important? One of the critical benefits of clinical governance is the focus on patient safety. One aspect we all learn as a healthcare professional is no matter how many hours of sleep you get, no matter how many years of study you've had, and no matter how focused you are, human error is inevitable. When we have animals' lives in our hands, we need to do everything possible to reduce risks of human error, optimize clinical effectiveness, and ensure consistent evidence based clinical care. This can be delivered through checklists, SOPs, audits, benchmarking, growth mindsets, and evidence based protocols. By utilizing these tools, they ensure that clinical decisions are grounded in the best available evidence, research, and expertise for clinical effectiveness. It provides a systematic and standardized method to minimize errors, enhance communication, and adhere to protocols, which reduces risks from human error. It also assesses areas for improvement and compliance rates and compares performance against industry standards or peers to motivate innovation and ensure consistent evidence based care is delivered. The collaboration of these systems fosters high quality, safe, and multidisciplinary care. Clinical governance also enhances public trust in the veterinary profession. When clients see that their veterinary team adheres to protocols, adopts systematic approaches to eliminate risks, transparent communication, uses scientific knowledge for optimal outcomes, and consistently delivers high quality standards of care, it creates a deep sense of confidence and respect in the profession. Public trust is further reinforced when adverse events are managed with integrity through incident reporting systems and significant audits, which allow for learning and prevention of further occurrence. Clinical governance enhances the professionalism of the whole veterinary team by utilizing confidence and skills. Being confident and skilled means that as a nurse, you have the privilege to implement tools such as evidence based practice, continuous learning, and regular audits to ensure that every team member works to deliver high quality care. This enhances professionalism for the veterinary team as it ensures that they remain up to date with scientific knowledge, filtering out techniques to provide optimal care and demonstrating our commitment to professional excellence. It also aligns with guidelines, legislations, and codes of conduct that apply to veterinarians and nurses, which upholds our professionalism. Systematic quality assurance demonstrates accountability to clients, which enhances the professionalism of veterinary nurses and the whole team. On an individual basis, it encourages self reflection, skill development, effective communication, and increased job satisfaction, which overall contributes to the professionalism of the whole team as everyone comes together to combine their skills. It helps to increase interprofessional collaboration by improving clinical effectiveness, building confidence between veterinarians and veterinary nurses regarding the delegation of clinical tasks. Through systematic approaches, standardized protocols, and evidence based nursing, it minimizes errors, ensures patient safety, and provides optimal outcomes for the patient. This showcases veterinary nurses' competency and skills, which builds trust and instills confidence from vets. The shared goals between vets and nurses, known as beneficence, facilitates communication, reflective practice, and teamwork, which creates a culture of shared learning, cross-disciplinary training, and mutual respect. This increases interprofessional collaboration and strengthens trust to deliver effective care. Clinical governance allows for clearly defined roles and responsibilities, which enhances the vet's confidence in delegation, allows for vets to trust nurses with clinical tasks, and empowers nurses to develop skills and take on greater responsibilities. Clinical governance promotes a team centered approach, encourages shared learning and continuous development, which strengthens bonds and leads to increased interprofessional collaboration. As frontline workers of veterinary care, clinical governance provides us veterinary nurses with the opportunity to take this niche realm of care that's within our everyday care, specialize in it, and lead the elevation of our profession. It allows us nurses to demonstrate our value as clinical governance ambassadors by actively utilizing tools such as audits, protocols, and evidence based practice initiatives as we are at the epicenter of a patient's care. Stepping into a role of leadership and promoting a culture of continuous professional development, accountability, and acting as a model for clinical governance. We can encourage reflective thinking, lead training sessions, and enforce high standards of care, further cementing our professional standing. As clinical governance evolves, we have the opportunity to expand our responsibilities, proactively engage the team, influence policies, and advocate for patient safety, which enhances the perception of our profession and demonstrates our position as integral members of the veterinary team. What skills and capabilities are needed to successfully implement clinical governance? To successfully implement clinical governance, professionals need to develop a range of cognitive, technical, and interpersonal skills that foster a culture of organization and accountability and contribute to clinical governance. Reflective thinking skills and a growth mindset are critical to evaluating personal performance and viewing areas of failure as a learning opportunity and skill development. This is essential as it breaks down stigmas and barriers around failure, promoting a sense of accountability, increased job satisfaction, continuous professional development, and a structured approach to clinical governance. Methods to gain these skills include adopting a mindset that embraces challenges, focusing on incremental improvement, setting realistic goals, using structured reflective processes such as GIBS, keeping a reflective journal, and actively engaging in team debriefs to gain new knowledge. Critical thinking, analytical, and technological proficiency are also skills that are essential in administering clinical governance as they promote a sense of accountability and knowledge gaps. Data analysis, collection, and reporting, and being able to identify system failures are integral for system success. And this can be achieved via engagement in audits, benchmarking, evidence based practice, training for implementing these tools, and using data management softwares. Now, you may be thinking, this is amazing, Kaylee, but where's the catch? How come I don't see this everywhere if it's such a powerful approach? Well, there are a few barriers to implementing this. Fear not, I'm here to prepare you with ways to overcome those barriers so you can work towards building your dream team. Lack of time and resources. Time is a very big aspect of our lives as veterinary professionals, as it is always slipping through our fingers with busy clinic schedules and staff shortages. A solution to overcome this barrier would be beginning with small manageable changes, such as conducting reflective meetings or introducing a surgical checklist. Delegating responsibilities across the team for an even workload to integrate clinical governance into everyday practice, like researching the best nursing interventions for a specific hospital patient and utilizing digital tools to streamline the process and make changes if required. Resistance to change. Many team members will be hesitant to adopt a new process after they have been comfortable with existing protocols. The solution to this is transparent communication, communicating the benefits of clinical governance, such as patient safety, but also emphasizing the benefits to staff, such as professional development and improved job satisfaction. Involve the team in decision making, create an open space for feedback on the proposal, and design an approach based on this. Gradual implementation is key, by focusing on one process at a time and checking in with staff to review their thoughts. Blame culture. The prompt actions of finger pointing, scapegoating, and defensiveness can be eliminated and replaced with a culture of accountability. Strategies include displaying model behavior and holding oneself accountable. This will show staff that there are more benefits to stepping forward and acknowledging mistakes with absolutely no punishment. Instead, praise and benefits of self reflection, professional development, and improved job satisfaction. Education regarding adopting a growth mindset and thinking skills is integral. Therefore, doing a course as a team or simply holding regular team debriefs to discuss individual and team progress can be a huge step forward. Insufficient knowledge or training can be tackled by providing accessible training resources, CPD courses, online resources, and mentorship programs to gain knowledge and build confidence. Encouraging the team members to delve into CPD focused on clinical governance topics and using case studies to demonstrate the value of clinical governance in the veterinary industry. Poor communication and collaboration. If this aspect within the team is ineffective, it will result in system failure. Therefore, to overcome this, you need to foster a supportive environment. As a leader, set the example with clear and concise communication. Schedule regular meetings and check ins with staff members to create trust, share progress, and address challenges. Trust is a core aspect that enables a clear flow of communication and collaboration. Focusing on team building exercises, whether it's outside of work activities like escape rooms, which allow for you to collaborate with team members, or shared lunches, which encourages communication and builds bonds. This allows for trust, confidence, and respect to be translated into the clinic setting via effective communication and collaboration. Fear of judgment. Some team members may feel isolated, threatened, or perceived as punitive, which discourages engagement. This is where communication from you as a leader steps in. The concept of self reflection and growth mindset must be delivered in a positive light to team members. When the tools of incident reporting, systems, and audits are used, ensure that all staff members are notified of this and are aware that this focuses on identifying system issues rather than individual failures. Providing an anonymous reporting system can also aid those who would feel more comfortable providing feedback that way. Limited leadership support. Without strong leadership, clinical governance initiatives may lack direction or be implemented incorrectly. Strategies to overcome this barrier would be a discussion with the team in regards to who would be happy to step into leadership roles. Having a team member specializing in specific tools, such as one person leading auditing, one leading evidence based practice, and collaborating to educate the team and ensure implementation. This provides an opportunity for nurses to step into a role of leadership and a niche specialization to the team towards the desired outcome. Leadership training can be provided via courses and encouragement to model best practice. Overwhelming volume of processes. Implementing multiple processes at once can be extremely daunting and can lead to burnout. Therefore, to overcome this, there should be prioritization of key areas that require improvement, using a systematic approach and focusing on one process and regularly adjusting processes to ensure they are suitable. For example, if I've identified that surgical nursing needs improvements, we can begin by measuring patient outcomes before using a surgical checklist so we can find baseline values. This means collecting data from a range of patients with various signalments. Step 2 would be creating a concise procedure for how to utilize the surgical checklist to ensure that the approach is always consistent. Step 3 would be auditing the process of filling out the checklist, which includes ensuring that it is completed consistently, accurately, and precisely. Step 4 would measure patient outcomes after the surgical checklist has been implemented and compare the results against previous measurements to analyze if the surgical checklist is producing improved patient outcomes. The last step is to identify if there are any issues with implementation and address this, re-auditing regularly and reflecting on the outcomes. I hope this has inspired you, my fellow veterinary professionals, to take on an active role in delivering safer, high quality, and meaningful care via clinical governance. Thank you so much for watching.